Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
And
therapist.
together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
All right, today, Brad, we're going to talk about quick relief for knee pain.
Right there, you
or
bet.
knee arthritis. Very simple here, and this is, when I have people come in with arthritis, the first thing I tell them is that arthritis has a tendency to flare up and it tends to calm down. And if you're coming in, it's often probably flared up at that moment. Well, that doesn't mean that's how it's going to be from here to the eternity. All it means is that it's flared up right now. Let's get it calmed down.
Right.
And of all the treatments I do with people, Brad, I feel this does the most, and that is simply let's reduce some of the weight on the joint.
Sure.
Because generally the joint feels a lot better sitting, doesn't it, or laying down?
Yeah.
So what are the ways we can reduce joint stress? Number one,
Take some weight off.
take some of the weight off, and you can lose weight, of course, but that's not quick relief, is it?
Right.
Quick relief would be maybe don't be carrying around your purse, that is filled up to the brink, as usually a lot of the women's purses are.
They got those big ones now. You
Yeah.
can put 25 pounds in them if you
You
want.
got your man purse, right?
Don't bring that up.
All right, but now you've got a briefcase type of thing.
Oh, right.
You can lessen that. But the other thing is really probably to consider using a cane, especially if you are not using one, or if you're further along and you got two knees, you might have to use a walker. And I get so much pushback on using a cane, but the fact is, Brad, what looks worse? This or this? I mean, seriously.
Right.
I mean, people think that you're going to look old because you're using a cane, but this looks better.
I just talked to a man this morning, and he's got hip arthritis so bad. He come out walking to me, and he told me a few weeks ago I'm going to get a hip replacement. He came out walking like this, and I said, "So, you're going to get that surgery?" And he says, "Yeah, my wife talked me into it," but he still won't use a cane, and he looks like he's about 80,
Yeah.
and he's only about 60.
A cane is kind of like a gentleman's thing,
Right.
And so let's real quickly talk about the height of the cane. When you're measuring a cane for somebody, you want to have them stand up really tall, and you want to put their hand out in front of them like this.
Yeah.
And it should hit them about the wrist level. That's
Right.
a little bit low for me, isn't
This
it?
one should come right about to
Yeah,
here.
hit me right on the wrist.
Yeah.
Okay? Now, you can use it, let's say I'm having pain in my right knee. You can use it really on either hand. You can do the House method, you know who I'm talking about?
Dr.
Dr. House. He kind of just limps along like this, which, by the way, is not as natural. I
Right.
mean, it looks like, pretty stiff-legged, and it looks like you really are having problems. The more natural way is to go opposite, and when the foot is forward, the cane is forward.
Yeah.
And believe it or not, just that little bit, taking that little bit of weight off, I've seen it calm down knee pain and knee arthritis, and gives a person a few more years before they might have to have something done about it.
You better believe it.
And the other thing goes without saying, avoid stairs. I've had people say, "Oh, I thought I should do stairs to strengthen it." It's like, no, when it's flared up, you just want to strengthen it in other ways without having to, irritate it. Exactly. So avoid hills. Anything else, Brad?
Well, any weight-bearing activity that irritates it makes it. If you get sharp pain in it and it's irritating it,
Don't be carrying
Don't do
things
it.
around heavy, so
Right.
that's our quick relief response or idea for trying to relieve arthritis.
yeah. And remember, it's temporary until it comes
Yeah.
down, and then put the cane away. I don't know, Bob. I think it's a good idea. So if you're 40 and over, this is going to happen to you probably
Yeah.
by sooner or later.
Yeah, it's common. I hate to tell you that, but yeah, so you're going to want to subscribe to us because we're going to give you a lot of helpful hints on how to combat these pains and stay fit throughout your elder years. Take care.